good morning, everyone. I'd like to again welcome and introduce Dr. Robert Murphy, Executive Director of the Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Institute for Global Health's Facebook page. And we invite you to continue to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion here today is Katie Berg, who is an intern here with the Institute for Global Health. So Katie, I now turn it over to you.
Thank you so much, Kristen, for the intro, and welcome to all the viewers. Thank you again, Dr. Murphy, for being here and answering the questions. First, just going over some of the most recent headlines that we've seen from this week. Following the 4th of July weekend, can we anticipate that there will be a large spike in COVID?
We are expecting to see a little bit of spike, but as the data is showing, the spike is predominantly in the people that are unvaccinated or have not completed the full vaccination schedule. But wherever there's mass gatherings, we will expect this. What's happening is that the Delta variant, which is much more transmissible, is now taking over in the United States, and it's just very easy to transmit. So it's just yet another reason to get vaccinated.
Yeah, piggybacking off of that, the best way to protect yourself from these spreading variants is to get vaccinated. So please do that if you are available.
Right, because it's so transmissible, there's a theoretical risk that the usual mitigations with masks and social distancing are not as effective. As they saw recently in Australia, where the Delta just exploded in these little pockets of people that got infected. So it can be very problematic.
And do you know any sort of ratio of what percentage of new cases are vaccinated persons versus unvaccinated?
Well, the data are coming out in bits and pieces. I think the strongest data, most convincing data I've seen recently came from the state of Maryland. In June, just last month, 100% of the COVID-related deaths in the whole state were in unvaccinated people. 95% of new COVID cases, remember this is a reportable disease, were those who were unvaccinated. So there you have 95% versus 5%. And 93% of all hospitalizations were in unvaccinated people. So it's clear how effective these vaccines are in preventing death, serious disease, and hospitalizations.
Yeah, those are certainly staggering numbers. Switching over to our submitted questions, a viewer would like to know that if they had a very strong case of COVID, how well are they protected against the Delta variant and other variants?
It really doesn't matter too much about the variants. It really is just how protected are they against COVID. All right. The answer to that question is, I don't know, because it's not really predictable. Even if you had a severe case of COVID, how protective your antibodies really are. You do get some protection. Very few people get a second bout of COVID within 3 months of having COVID, but then the immunity can wear off. It's very hard to predict, and doing the commercial antibody tests that are out there is really unfortunately not good enough to determine whether you're immune or not. So it doesn't matter if you had a severe case, you are not really as protected as if you had the vaccine. So everybody that's had COVID should also get the vaccine. Matter of fact, the immunity from the vaccine is actually better in people who had COVID. So you get sort of this boost from the COVID, and then you get the vaccine boost. But you definitely need the vaccine, even if you had COVID.
Right. And a funeral director was asking for the safety of her staff members, how long could COVID remain contagious after a patient died, or are there special steps that they should be taking to be safe?
Well, from just what I've heard, it's not a big problem. in funeral homes. There's really just anecdotal cases reported of transmission. And it's not even certain that the transmission was actually from working in the funeral home. And the usual precautions that funeral homes take to prevent HIV, hepatitis B, other infectious diseases are more than enough to protect against COVID.
That's great. Another person was wondering if it was safe for them, if they are fully vaccinated, to return to their indoor water aerobics class, even if there are up to 30 people in the pool, and commented that she would be willing to wear a mask in the pool.
Wearing a mask in the pool is probably not a good idea. I don't think that's really necessary. This is not a waterborne disease. This is an airborne disease. And I think really, if this person is fully vaccinated, they don't have anything to worry about.
That's great. Now, a little bit of a longer one. A patient with an underlying cancer condition, leukemia, has very low antibodies following their vaccine as tested by their primary care physician. They have 2 upcoming events that they are going to, and the first is outdoors, and only one 4-year-old child is unvaccinated. All of the other 21 guests will be, and the other is a fully vaccinated private dinner room. Are there any steps that they could take, additional steps to support their immunocompromised family member?
Well, it sounds like what they're planning is okay, but there is still a risk because of this one unvaccinated child that's attending. You know, getting COVID in a person with underlying hematologic malignancy is very risky. So I'm not, that's a personal decision that has to be taken. But it's a common enough problem that many people are looking at different vaccination schedules. For instance, in the entire country of France, based on the limited data that's available, all these people with hematologic malignancies, even other malignancies, are getting a 3rd dose of the vaccine. And there have been studies looking at people with cancer who didn't have the good antibody response like this person, and giving them additional vaccine doses. It's not part of the schedule right now to do that in the United States. It's not in the guidelines yet, but it's definitely going in that direction. And I think you're going to see some kind of change soon. And some places are just doing that, even though it's not a part of the guidelines at this particular time. You have to remember that the United States government actually bought all the vaccines that are administered in the country. And so if you want to keep getting those vaccines in facilities, you got to follow the rules. But I think those rules are going to change very soon because of the studies that have come out that did show that there is response in people who have organ transplants, as well as these malignancies, especially the hematologic malignancies, that they do get some effect from more frequent dosing. And it may even require more than one booster dose. So this will be the first group of people that's likely to be approved for actual booster doses.
Wow, yeah, that perfectly leads into our next question, where another patient with leukemia/lymphoma was asking, well, first, what should they say about their vaccination status? They technically did receive both doses of the Pfizer vaccine, but unfortunately do not have any antibody activity.
Yeah, well, again, there's a couple things here. One is that the commercial antibodies that are being measured that from a primary care doctor's office are not really reliable because it's a slightly different antibody. It's a much more complicated thing to do. And then there's another whole part of the immune system, the cellular immune system, that we're not measuring routinely at all. So it's not an easy question to answer, but we know that these patients are the ones that have the problems. And so, you have to assume, even with the regular vaccine schedule, that that person is still at high risk.
Should they consider trying to get another vaccine now? I know you just said it is not currently recommended, but for their safety.
Well, I mean, they're going to have to deal with their primary care doctor, and primary care doctors now can get vaccines in their offices. The big vaccination centers are closing down if they're not already closed already, and it's moving out into communities and doctors' offices. And that's where this kind of transaction is going to take place. So it's really going to be up to the primary doctor, and I'm sure they're doing the best for the patient, but that decision is at that level.
Well, thank you so much for answering all of the submitted questions. We really appreciate it. Thank you everyone for joining us and watching, and I hope that everyone has a great rest of their week.
Great. Thank you.